Perfect, thank you. So this project is really a good example of what happens when you bring the sustainability lens to something that you hadn't initially thought of as a sustainability project. So we started this project as a way of working closer together, the three practices within our clinical network. And we focused on diabetes because, as many of us know, diabetes is a real heart sink when it comes to healthcare. The outcomes for patients are often very poor, takes a huge amount of medication and time in secondary care. And as a GP over many years, I've very rarely seen a great deal of improvement in patients with the clinical pathways that we currently use. And so we thought about how could we do this differently? And we looked at actually a complete change in mindset, and that type 2 diabetes is really a reversible disease. It's a disease of exercise and diet, or poor exercise and poor diet. So we wondered what it would look like if we thought about type 2 diabetes treatment as being good food and good exercise. So the next step was to really engage our social prescribing workers. And so we used our healthcare coaches to engage with our diabetic patients, giving them dietary and exercise advice. And the real reason to use our social prescribing team is that they were able to look at the barriers for many of these patients as to why they weren't engaging in their health. So the patients were given one-to-one access to our social prescribers. They were given diet and lifestyle support. They often met our social prescribers and health coaches outdoors for a walk in our local parks or on the coast path. And so they were encouraged to engage in physical activity in the fresh air. They were given tailored diabetic education to their needs, depending on what their cooking facilities were like, what their job situation was like, and their family situation. And the aim was to show not only a reduction in their biometrics, their HbA1cs, their blood pressure control, cholesterol and weight, but also to improve their general well-being. One of the barriers that we came across very quickly was the lack of affordable, accessible, healthy food. So we were fortunate to be able to access some funding through public health, which allowed each person, a select group of patients, to receive a weekly veg box. It was really important to us that these veg boxes were provided by a local growing space, which is a community interest company. And the patients were encouraged to actually access the veg boxes directly from the growing space, so that they were able to engage with the volunteering experiences there and to see exactly where their food was coming from. Another advantage of the veg box scheme was that patients were given a recipe card and a newsletter. Excuse me. So the outcomes were very, very encouraging. The interim results showed that all patients who received a veg box had a reduction in their biomarkers, and they also decreased in their weight and increased their social interactions. So the social prescribers used the SWEM-Web scores, and patients definitely noticed an improvement in their social interaction. The feedback we had was excellent from the patients. They really enjoyed having fresh vegetables being made available to them. One patient actually ate vegetables for the first time in his adult life. We found that patients were sharing recipes with their families and friends and encouraging others to go out and purchase vegetables and prioritizing these in their weekly shopping. We found that actually the input of our diabetic health coaches was really, really beneficial to our usual diabetic care pathways. We saw that all our pre-diabetic patients who went through the diabetic education were able to remain either pre-diabetic or back into the normal range, and none of them advanced into type 2 diabetes. All the type 2 diabetic patients who engaged with our health coaches, it showed an improvement or remained static in their biomarkers. And the only ones who had an increase in their HbA1cs were the ones that didn't engage with our health coaches. So moving forward, we're continuing to with this process and our diabetic care pathways, we're making some adjustments, and we found that the recipes that were given by the veg box providers were often quite complicated, And so we're simplifying the recipes, and we're providing pictorial recipes as well for patients because of the educational levels that we have in our communities. We're also simplifying them to be adaptable for what patients have in terms of their cooking abilities and their cooking facilities. The ingredients are kept very, very simple with very little additional ingredients, but when they do need things like spices, these are being shared amongst them, so they're not having to buy large quantities just when they need just a teaspoon of something. The patients are being encouraged to participate in the volunteering experiences at our orchard and our growing spaces. And our community hub is providing the facilities for us to do cookery classes for the families involved in these schemes. And this has been noticed across our ICB now. So we've actually managed to roll this out into other practices. We're trying to link all our GP surgeries with the local growing spaces around Cornwall. We've networked with the Cornwall Sustainable Food Partnership, and we are engaging with public health and our ICB to really learn from our communities and our local growers how we can best support our patients to create health from the start rather than waiting for patients to become unwell. We are fortunate to be able to work with some researchers from Bath and Cardiff University, so we're hoping to capture far more metrics so we can start looking at the results of these schemes and looking at both the carbon reductions and the environmental benefits, because hopefully by supporting our local growing spaces, we can improve our biodiversity in our natural areas as well. We're developing this network and we're running face-to-face events, and hoping to secure further partners and resources in the future. The QR code there is to our website. This is the Primary Care Sustainability Group in Cornwall, and this is our health creation page, which we've called Well Fed Cornwall. And hopefully we should be able to report back in the future with even more statistics on the benefits of this scheme. And I'll leave it there. Thank you.